Welcome to the Trailblazers. I'm your host, Perry Rarick. The purpose of the Trailblazers is to share with you interesting discussions I have with trailblazing business leaders. They're innovative, they're experts at what they do. They don't shirk from difficulty, and they're not afraid to challenge the status quo. My Trailblazer guest today is John Chiminski. Many of you will recognize John as the former CEO of Catalent, a role he assumed in March of 2009. He went on to also serve as chair of the board and executive chair all the way through June of 2023. That's a total of 15 extraordinary years. You're going to hear the word extraordinary come up a lot in this discussion. 15 extraordinary years with Catalent, and that's what we're going to hear about today. John now serves as a board member of Kydell Ortho and Radiology Partners, senior advisor at Bourne Partners. He is a board member of the Purdue Engineering Advisory Council, and he previously served as board director of Phenomics and DJO Global and Graham Packaging and chair of Ascend Advanced Therapies. Prior to Catalent, John spent more than 20 years with GE Healthcare, where he held senior leadership roles across engineering, operations, and global business units. He holds a bachelor's degree from Michigan State, a master's from Purdue, both in electrical engineering, as well as an MBA from the Kellogg School of Management at Northwestern University. John, it is an honor. Welcome to the Trailblazers.
Well, it's great to be back with you, Perry. And I know that introduction was to give me some bona fides and make me seem really accomplished, but it made me seem like I'm really old at this point.
We can't stop time. But it is great to have you, John. I've been looking forward to this discussion for a while. Well, let me set up our discussion. This is big. You're a big deal. This is a big discussion today. It's really important. There's going to be a lot of really important lessons gleaned from this. The story of Catalent is one for the ages. It began in 2007 when Cardinal Health sold its pharmaceutical technologies and services division to the Blackstone Group. They renamed it and rebranded it as Catalent. And John, you became the CEO about 2 years later. And over the next 15 years, if I get the numbers wrong, you can correct me, but over the next 15 years, Catalent expanded its capabilities and capacity from about 20 facilities to 53. And then through a combination of strategic acquisition, capital investment, and a shift toward high-growth biologics and advanced therapies, which we'll hear more about. During this time, annual revenue grew from a little more than $1 billion to almost $4.4 billion, and its enterprise value quintupled. And in 2024, Novo Holdings acquired Catalent for $16.4 billion. John, you led Catalent You led Catalent during this extraordinary period of time, and today we're going to hear the Catalent story from your perspective to include challenges, triumphs, and lasting lessons. So this is a story of epic scale, and so I'm going to start by in the beginning. How's that sound? So in early 2009, leading up into March, what were you doing that led up to you sitting down with a bunch of smart folks from Blackstone and talking about Catalent?
Well, first of all, I've got to tell you that, careers all come down to a few moments, and the ball bounces your way, or you make the right decision, or you don't. And I can't tell you, but for a phone call, I wouldn't have been at Catalent. And I don't mean the initial phone call, a phone call that I was making because I was so anxious about leaving GE and going to Catalent that I literally had picked up the phone at 7 a.m. in the morning after a sleepless night to tell the recruiter I'm taking myself out of the process. And guess what? The recruiter did not answer the phone, John Mitchell. I've never told John this story. And, my wife kept saying, whatever you want to do, I'll support you, which is, such advice I can't really tolerate. I've wanted somebody to help me with this decision. And uncharacteristically, John did not pick up the phone. And I wasn't going to leave him that voicemail. I had known John for a decade, and here I am at the cusp of taking the CEO job for Catalent. And so I drove to work. I just said, hey, give me a call when you get a chance. He never called me until 2 p.m. or 3 p.m. in the afternoon, which again was uncharacteristic. And in between that 7 a.m. call and the 2 p.m. call, I talked to two other people, one being the former CEO for GE Healthcare, John Trainey, and one other person that was the HR leader at GE Healthcare. And I just asked him, so just want to know where am I at, and would I be considered for succession afterwards, after the current CEO is gone? And he kind of chuckled at me and went, oh, John, that's a big putt, and I'm like, whoa. And when I talked to John Trainey, he said basically, hey, why are you taking yourself out of the process? You haven't finished the due diligence yet. Just keep going and see if you can get comfortable. So when John called at 2 or 3 p.m., he said, so what did you want to call me about? He said, hey, I want to give you the list of things I need from Blackstone to get comfortable with the CEO job. So, but for that phone call not getting picked up,
Wow.
and me doing my extra work, my career could have went other places. But back to your original question. So I always start with, I'm an engineer. And to a lot of people, that explains a lot of things. It's the way I think. It's the way I solve problems. It's the way I operate, right? It's all about details. It's all about excellence. And I arrived with an engineering degree to General Electric, which was an engineering company through and through, right? And that's a place where I just absolutely, I would say, GE made me above anything else. I mean, GE was a talent machine. They were all about bringing in the right people, growing that talent. Then they were about excellence in operations and quality. They were about innovation and driving growth. That was GE through and through. And so for 20 years, I really had that, driven into my DNA, along with whatever personality traits that I had growing up in Detroit. And, I would say, just very, we were a middle class family, lower middle class, but we were just fine. But you learned how to make do with very little, right? And that also was perfect for GE. And, I had basically gone through GE, through first in operations, then in engineering, then ultimately I ended up running businesses. And the interesting story, and you heard this probably in another podcast or two that I had done, but I had a boss, Joe Hogan. He's now running Align Technologies, if you think of Invisalign. So Joe was my boss, and he came to me one day and he said, I was in engineering, and it was for CAT scanners. We'd just launched the Six Sigma product, Lightspeed, very successful. And, I was like set on this path as an engineer with an advanced degree to ultimately maybe, be the senior vice president of research and development for GE. That was kind of the thing I was thinking of. He said, John, you're a good engineer, but I think you could be a better business leader. And again, back to a few moments in time. And he basically moved me over to run GE's healthcare's service business, which was, it was the highest margin and highest operating margin of the company. We sold equipment, we made money on it, but servicing it, we made a lot of money on it. I mean, you always hear about GE and their service strategy, whether it's aircraft engines or MRI machines. And I went in there and was able to lead that team for about 5 years and really understood customers and the service model. Fast forward a little bit, GE really went through a significant transition with, Jack Welch stepping down, in 2001, Jeff Immelt coming on board. In fact, another interesting factoid, the day that the board approved Jeff as the CEO, it was the same day that I was approved as an officer. So we were like, it was just kind of one of those interesting things that happened. And then by, Tuesday of the next week, 9/11 hits, and, Jeff's got an unbelievable, challenge on his hands as a plane that GE leased flying with GE engines ran into, the World Trade Centers,
Wow.
which were buildings that GE reinsured. So,
Oh my gosh. Wow.
that was a bad day for Jeff. And then that was a kind of an auspicious start. And then, from 9/11, we ended up having the financial crisis in 2000, and 7 and 8, and a lot of stuff in between. And GE was not, exactly the company that I had started with and had remembered. And there was a lot of changes going on. And it was at that point in time that I started thinking that, maybe, GE isn't the place for me. In fact, I'll tell you one little other story back to, things that are important in a career. When I really made my decision, I got a call, I think it was in 2005. Again, it was from Joe Hogan, and he said, "Hey, we want you to go run the MRI business." Now, 99 out of 100 GE people would go, "Wow." Okay. I started it in MRI in 1988 when it was a nascent business. So now I get to run the MRI business. Problem is, I had already progressed hierarchically past MRI business and was an officer of the company. This was a senior executive job, but it really needed a lot of help. And I was known as the turnaround guy, and they really, MRI was their flagship product. And so they called in, the sergeant that could go fix it, which was me. And I'm like, I don't want to go run MRI. I'm running service. And so Joe says, well, let me have you talk to Jeff. So Jeff calls me up. He goes, John, I like you a lot. You're doing some great things and I respect you a lot. So I'm not going to make you take this job, but I'd like you to take it. What do you do when the chairman of the General Electric company says they'd like you to take the job, but I'm not going to make you take it? I took it begrudgingly and I dragged my feet. And when I went in there, I was a bull in the china shop. I'm like, you need me? Well, we're going to fix this damn place. And I was unhinged. But that's when I took my first recruiter call. When I'm like, if GE could just plot me into all these little jobs that I don't want to do, maybe I've got to start looking outside. So starting in 2005 with John Mitchell, by 2009, he called me and said, hey, I think I got a great job for you. And I said, nah, I'm not going to do it. He says, they want a GE guy with healthcare experiences that's run a service business. That's you. I said, yeah, but I just got here. I'm doing something else. It needs me as a turnaround. By then, I'd already progressed a couple of steps past MRI into running a specialty diagnostic pharma company that they acquired from Amersham.
Oh.
But he twisted my arm. He says, if I don't deliver you, they're going to go to another search firm. Would you at least take the interview? So I took it.
Yeah.
And so the combination of, not being completely happy with GE, feeling like they had tossed me around in a couple of jobs I didn't want to do, and didn't know John Mitchell, I ultimately took the call. And here's the problem. When private equity is looking at a business like Catalent, right, they do an incredible amount of work. And they had a business case. So when John Mitchell called me up and I finally agreed to take the interview, he turned over the business case. And I still remember where I was sitting in my, family room. A little fire was going. I was sipping on a glass of wine, and I'm turning the page on this business case that they had. And the more every page I turned, I got more excited about it
Ah, yeah.
because I'm a business junkie. And everything in there was nothing that concerned me. You know, I understand, regulated products. I understand the FDA. This was a highly intensive operational business at the time and at 33 sites. And they had this interesting technology and a thesis for the growth, whether it was soft gels or Zydus, packaging at the time, sterile single-use syringes. Can you believe it? They actually had that thesis back in 2000 and, 7, that single-use, sterile syringe was going to be a huge market, not knowing about the GLP-1s. But as I turned the page over and over, I got more and more excited. And I kind of backed up after telling you but for a call that never got answered, I might not be at Catalent. I then finished that due diligence, got really excited about taking on the job and, accepted it and made the call.
Incredible. The suspense in that is something
Oh,
great. Great story. A lot of lessons in there. The people you spoke to, that you reached out to, people you trusted, people you had a history with. Very interesting. And I think a really important point in all of that. A number of points.
listen, I tell CEOs, like, you need to engage in network outside of your HR leader, your general counsel, and your board, because sometimes you just need some other outside voices to give you input. When I talked to John Trainey, he was the one that told me to call HR. He says, "Hey, John, if you get a shot at becoming a senior vice president of General Electric company, like, you should probably stay." He said, "But if you get the signal that you might not be an SVP, which the ho 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 of Mike Hanley told me, that's a long putt, John. We're a $17 billion company. We're going to be a $24 billion company by the time John Deneen leaves." When I got that call, when I made that call, that was John Tranny telling me, check first. And if you don't have a clear signal that SVP is in the cards for you, then you just
Yeah.
need to complete out your due diligence with Blackstone. And that's what I did. So I can tell you the number of times I did that with Catalent. I used a guy called George Fotiades, who was the former chairman of Catalent in that interim period between the previous CEO moving on, and then before I came in to replace me. I still talk to George on a weekly basis, mostly by text, but every now and then with a call. I had Ram Sharan, and then we had other CEOs that I would talk to on a regular basis. One of them, David Simmons, who was a Carlyle-owned business with PPD, but it's absolutely invaluable. And, think about that decision. And I'll just say this, and I know you want to get into the Catalan story, but the advice I give, to CEOs, I actually gave this advice to Alessandro, who's now running Catalan. And I said, look, we're all really smart, right? But the difference between a good CEO and a great CEO is that a good CEO gets 80 to 85% of the big questions right. And a great CEO gets 90 to 95% of the big questions right. And the difference in that 5 to 10% is listening to others who have been there and done that and can help you make a better decision, whether it's your board or, outside influences, folks like Ram Sharan, etc., leveraging a McKinsey team or whatever. But that ability to listen, it's really hard for CEOs because you're smart. That's how you kind of got there. But, you're so smart that you think you have the answers for everything. And the fact is that most things aren't just from critical thinking and reasoning, it's also from experience. And we don't have all the experience. Who had the experience for a pandemic, right? Who had the experience for the financial crisis? Who had experience for 9/11, right? So unfortunately, that's why a lot of the great CEOs are, they're C60s and have gray hair. right? It's an experiential job.
Yeah. So I want to stick with March of 2009. And what were your expectations before day one on the job? What did you do in the first 90 days? And then how did reality differ, or was it aligned with your expectations?
Well, here's the funny thing. The job started 2 weeks before my start date, and I'll explain that. But the beauty of, having the business case from Blackstone and then the amount of due diligence I did, Tom Castellano, who was the former CFO of Catalent, and he was also a long-term FP&A and treasury guy, great, great finance mind. He, in my going away, shared with me a binder that he had kept. And he said, John, before you joined Catalent, you said, I have a few financial questions for you. And he shows the binder, and it's this thick. And he goes, this is what you asked.
Oh my gosh.
So I did a financial review. I did a talent review. I did a quality review. I did an operations review. I did a legal review. So I had went in almost as though I was the private equity firm acquiring Catalent, because I spent 20 years at GE. I was going to burn the boat. I was going to a new island and burn the boat, because when you leave GE, you ain't a coming back. All right. I mean, this is a place that's like, the best are here, and anybody that leaves, we don't ever need them again. And that is the culture of GE. So when I signed up, like, this was the acquisition for, my family, my future. I had 3 young kids, so I did all of that due diligence. So I really knew what I wanted to do, and I'll explain it to you. Then I'll talk about the 2 weeks prior. It was absolutely clear that as an operationally intensive company, this company just needed to first be run well. What do I mean by that? Like, the trainees got to run on time, right first time, on time delivery of batches, the quality, the deviations. You do that stuff right in an operationally intensive, FDA regulated business, and, 50 other regulatory bodies, you're going to do well. So I basically came in and said, excellence in operations and quality plus innovation equals growth. That was my thesis going in, right? Pretty damn simple. In fact, I had done a presentation for day one, right? That I delivered on day one, and I worked on, right, to explain to people this is what I was going to do. I mean, nobody needed to tell me, the plan. I had done all the due diligence. I knew how to run businesses, and I was going to go run Catalent, right? And the problem is due diligence is imperfect, right? You only get information that's given to you, and you trust it at face value, except for maybe the financials and legal and whatever. When you're doing a talent review, you have to trust, the judgment of the person telling you about talent on the team, right? Well, anyway, one of the due diligence I did was quality. And George sat at a board and he said, well, let me rate the sites for you. And he said, I'll start with our number one site, St. Petersburg, soft gel site. It's an A. And then he walks down and he says, Woodstock, sterile fill, that's a C. But I really like the GM. And then he gives an F to a North Carolina sterile site that had a warning letter. So they had a warning letter when I came in. Well, 2 weeks before I start, I get a call from Tom Stewart, who's running Softgel. And he said, hey, John, I just wanted you to know, actually, I didn't get a call. I first got an email that was forwarded to me that the FDA had gone in. They spent 4 to 5 days at St. Pete's, and they gave them 9 observations. So I'm like, what? This is the A site has 9 observations. By the way, I'd already resigned from GE, and signed up with Catalent, with my start date being March 17th. And this was like March 1st or 2nd.
So you own it at this point.
It's Friday. I'm starting on March 17th, and it's, on a Monday. So just, back that up. So the 10th, the 3rd. So yeah, it was like March 1st. The first thing I do is I call up Tom Stewart, who's we hadn't actually met, I don't think, at that point. Hey, Tom, John Chiminski, I heard about your observations. What's the plan? He goes, well, John, and he could tell by the urgency in my voice, don't worry, settle down. We're very good at managing the FDA, which is like somebody with nails on the chalkboard to me. We're very good at managing the FDA. And actually, it may not have been Tom. It may have been the quality leader at the time, which was even worse. So the quality leader is telling me this. So then I talked to Tom. I said, Tom, what's the plan? He says, well, we've got 15 days to respond, and we'll turn in the response, and then we'll keep you informed as things go. I said, no, Tom. I said, I want an initial response to every observation that you have. What is the root cause for how we got there? And I want to see that Monday morning at 7 a.m. He said, but John, if we have to deliver this to you on Monday at 7 a.m., then the whole team is going to have to work all through the weekend. And I said, that's exactly the point. Back to what was it? What did I think I had versus what I got? I didn't even arrive yet, and my due diligence was blown.
Wow.
So my speech is around operational and quality excellence plus innovation equals growth. I could just cross off the innovation and just focus on operations and quality. And the truth of the matter is, that's what I ended up focusing on with the team for, about 4 years. I mean, between taking costs out and running the company well, that added almost all the EBITDA for us to be able to take it from 270 to 432. Another story, just real quick, what happened, so forget about my first 90 days. It's full on contact from day one. In the first 90 days, I visited almost every single site in the network, right? I mean, I just was on the road constantly, because not only am I learning about the operations, I'm meeting the teams and assessing those operations and giving them feedback for every one of the site visits they did, because we did an operational review, a quality review, a financial review at every one of those sites. So that's kind of what you're doing for the first 90 days. But in those 90 days, I already had a board meeting. The board's pounding their fists on the table. How are you going to grow this company? And I said, I'm going to run it well. They wanted some big strategy. It's like, guys, like, we just got 9 observations at St. Pete's. Like, my job is on the quality and operations front. So I was just tearing through it. About 6 months into the job, we have our first senior leadership team meeting, where we constituted a group of the top 150 people that were running the company, right? These are people that it's my staff, and then my staff, and then all the GMs that are running sites, right? And we did a lot of preparation, because I've really got to capture the hearts and minds of this 150 people. And did a great job putting the presentations together. We're up on there. We're down in Florida, pulled everybody in. The meeting has just a flat feel to it. After the first break, about, by the coffee station, and there's, one of the senior SLT members, senior leadership team members, right? I said, so what do you think of the meeting so far? Sip of coffee. We've had these meetings before. What's going to be different? My pupils must have just instantly dilated into 2 little beads. My ears got hot. I grabbed my admin, ring the bell, get everybody in there. You get everybody in there, 150 people sit down. I walk up on the stage and I recount what happened where I asked, how do you think the meeting's going? They said, fine, we've had plenty of these meetings, but what's going to be different? And I leaned into the crowd and I said, I'll tell you what's going to be different. You're the 150 people running this company. There's no 150 people behind you running the company. You're it. So you or someone like you will get this job done. Now, next speaker, please. I fired 75% of the senior leadership team within a year. We had changed over, maybe it was 18 months. My ELT, I changed out all but 2 in the first year. And then we changed out 75% of the senior leadership team, probably within the first 18, worst case, 24 months. And the point is that we just did not have the horsepower to run this company or the people that were really driving it. A lot of them came from pharma, or they came from unsophisticated companies. They didn't understand, what to do. There wasn't a single metric that was inside of like our plants. You walk in the plant, you never know what was going on. You just see machines working. There wasn't a metric anywhere. There was no Six Sigma. There was no, SQDC. There was no nothing. So I would say, what it took was sheer willpower on my front because I burned the boat. And then I brought in 2 people I trusted a lot. One was Sharon Johnson to be the quality leader, and the other was Steve Leonard to be my operations leader. They both actually quit GE on the same day, and neither of them knew they were both coming to Catalent.
No
So
way.
that's been quite a shitstorm for me when I got a call from Fairfield, Connecticut from GE and coaching their teams. So I had to deal with a few of those calls, but that back to your point, look, it was a good company and it had a lot of good people that were committed, but the level of excellence we needed, and I'm a little bit maniacal on that front. You'll hear stories about me walking around buildings looking for cracks. I went to an Italian site and you walked into the lobby and there's a little potted plant outside the door that's dying and there's cigarette butts in it. That's the entry for my customers and regulators. And then you walk in and there's a display of all the products they made in dusty cases. So if you know me personally, Mr. Car Wash himself, because I can't stand a dirty car or anything that's not excellent, like we had to start from the beginning. And I started with the lobbies, believe it or not. I'm like, when you walk into a Catalent lobby, it's got to look fantastic because it sets the tone for customers.
Yeah.
Let me back up. It sets the tone for employees, then customers, then regulators, right? And I got to give a shout out to Elliot Berger, who was probably he's the best marketing guy out there for CDMOs, and he created the Catalent brand. And it was with Elliot that Will Downey, who I brought in. So Will Downey, another kind of a GE guy. He was the G for a little bit, but before that, he was with pharma. He brought in Elliot, and so while I was working on the engine room with operations and quality, we were also working on the lobbies so that, the lobbies made more progress than the operations and quality. It was just CapEx, right?
Yeah.
But, we really had to do a lot of that. I mean, I sent these guys to Six Sigma immersion. I took the whole ELT to a Six Sigma immersion. I mean, Catalent really led the way from a CDMO standpoint with Lean and Six Sigma, and and it's still very much part of the DNA. When you go into any Catalent site and you go on the shop floor, you're going to see SQDC there, and you're going to see metrics, and you're going to see a level of professionalism that you'd expect to see in any farm plant, but 15 years ago, you didn't see it in a CDMO. You absolutely see it now. And Catalent's not the only one, but I think Catalent absolutely led the way from an operations and quality. And I know we burned a whole lot of time talking about that, but that was my start to Catalent, and kind of the first 4 or 5 years was just that.
Excellent. Yeah. That's really important. I love your candidness and the points you make, but It's very interesting. CEOs are walking into new roles and new companies all the time, and your insights are so essential. Simple, easy to understand, but so vital to correcting the course. So on a fast forward to 2014, 2016, a lot of hard work has taken place.
Yeah.
Starts out rough, things are okay, all right. And you're going to go through an IPO. 2014, there's an IPO. And there's a big job. I don't know how common, see the contract
There was no
manufacturing.
CMOs, there was no CMOs on the market
Yeah. Yep.
except for Patheon for a time was on like the Toronto market.
Yes.
They went private with JLL, and then you had Lonza, but they were a Swiss company, biologics. Um, they
Yeah.
were they
So
weren't broadly CMO.
how do you explain what you are to a group of investors who the pharmaceutical industry may be a little strange, let alone this essential need for CMOs? How do you go
Well,
about
first of
doing that?
all, back then, I would say nobody really put us in the category of essential, right? That was kind of a post-pandemic thing, but it was an integral part of the overall infrastructure. I mean, the outsourcing rate for CMOs was probably, I don't know, 25, 30%-ish. It was growing fast, right? Most of it happened, the CDMO industry basically happened from small startups of people that left pharma and started doing testing. And then they said, hey, can you manufacture the product? And then before you know it, they're manufacturing product or site disposition. So as we went through the big patent cliffs, what ended up happening is, they sold off sites, and these sites were jewels, but they were no longer important. And so the industry kind of happened that way, right? It wasn't, I mean, it's almost like the auto parts industry suppliers where, the fully integrated auto industry started spinning off their parts manufacturers that ultimately become Visteon or something like that, right? And now
Yeah.
everybody thinks, well, of course you have auto suppliers. Well, back in the day, everything was vertically integrated. So CDMO kind of happened that way. Look, investors, this isn't like you're following the PC market that every junior, analyst can understand kind of, right? Personal computers or handheld devices or something, right? This is an area where you're a contract manufacturer and they're trying to understand, well, where's your value and can't they just keep swapping from supplier to supplier? They don't understand that you're samplers. They don't understand that you're actually supplying the technology. And in Catalent's case, we're a supply. We were the leader in soft gel. We had a Zydis technology. We were very good at modified release. We had some other technologies. We had IP. And so you really had to explain to them the business model around how you have 75 to 80% of your backlog is locked up before you go into the next year, that, you generally have 5 to 7 year contracts, you're single sourced, you have automatic price increases. Like you're explaining the entire business model to them, and it's not all clicking all at once. And then they have action here or there. It was very, very, it was very tough. And the thing about an IPO, your investors are not committed to you whatsoever.
Mm.
1 hour with them, and they're going to take a certain amount of shares, right? They will or they won't. And you try to get overcommitted. So you're going to sell so many shares, and our book was only 2x committed. You want to be somewhere near 3x committed. It's very, very tough. And then on the opening day, as luck would have it, the market went down like 600 or 700 points that morning at the opening bell. It hadn't done that in 3 years.
My goodness.
So
Wow.
what ends up happening? Everybody freaks out. Everybody calls their, institutional investor and gets redemptions, and they don't have cash. So what do? They all huddle in a room. And they go, who are you not committed to? Well, guess what? Fidelity said Catalent. So Fidelity had a sell-in for Catalent below our IPO price on the opening bell. We opened up in 1950 and we were supposed to open at 2050, which means we should have been trading at $22 or $23.
Mhm.
1950, I think we closed below $20. So it was a rough day, but the good news is over time, we gain a reputation of, hitting our numbers, They didn't like the fact that we were lower growth. We're kind of in that 4 to 6% growth range, 6 to 8% EBITDA range, and people want to buy you as a growth stock. But the reality is, at that time, we were probably a little bit more of a value play with consistency. So this is split half and half, I think, between the two. But it was tough because we went from Blackstone, who I loved working with, where a bad quarter wasn't, you know, reason for cause and your CEO. As long as you had a trajectory and you could explain a bad quarter, they're fine because they're looking at value creation 2, 3, 5 years. In fact, they were in it for 9. But on the public market, like, you get a report card every 12 weeks. And that was a new dynamic that we had to face into. And I'll just say this. Even after we went public, I believe we were best in private hands up to the point where during the pandemic, we were just out of reach for anybody. At one point, we were like $25 billion worth of market cap. That's a public company. But when you're hanging out at 10, 15 billion, it's probably better for private hands because there is a lot of lumpiness in this business and the banana peel that seems to come every 12 to 18 months, whether it be customer market or regulatory.
Yeah. Yeah. What timing? Incredible. All right. So I want to go to the next era, if you're okay with that, the next era of strategic growth, but I want to highlight something that happened that kicked it off. So you've done a lot of hard work. This is not easy stuff. You're doing a lot of hard work. The company's doing well. You went through an IPO, and the board comes to you and says, "What's your strategy?" Tell us about that.
I got to tell you, I say I've got a, relatively low ego. I listen very well, but, running Catalent, okay, this is a grind every day. Like, you got to be on it, right? In terms of that level of excellence that we talked about. And we put in place a strategic planning process annually. So from the day I started in 2009, March, every April board meeting was a strategic plan. So I put actually the first strategic plan in place for the company in 2010 of April, right? And we had done one then in 2011, 2012, 2013, 2014. We did our IPO. 2015, we did it. Blackstone's still on the board. At the end of 2015, Blackstone sells the last of their shares. I become chair, and we're a completely independent public company with independent directors. I go to my January board meeting. IPO was successful, so to speak. Blackstone's out. They made $1 billion, give or take, mostly give. They probably made more because they were owning some of the debt and all of that stuff. And we have a good board meeting in January. This is, 2007, January of 2017. Good board meeting, standard. We got our strategic review coming up in April. And they have an executive session of the independent directors. I'm not independent, so I go out. And then my lead director comes back. I'm sitting in a big conference room at 345 Park Avenue because we're still using Blackstone's offices at the time. And my lead director was a man of few words. He says, "John, just some feedback from the board." I'm like, "Great. What do you have, Jack?" He says, "Well, first, the board believes you're the right CEO for this company and it is doing a really good job. And thanks you for that." I'm like, "Okay, check." Second, we think you've assembled a really good team and they're executing well and they presented well in today's board meeting. I said, "Okay, great. Thanks, Jack."
Good points. Yeah.
Sure. The board wants to know, what's your strategy? So I'm looking at him probably just like this. I said, "Jack, what do you mean?" "We have a strategy." He goes, yeah, we have a strategy. He said, but we believe, and actually I know which board member it was who did this, who was here, a good friend of mine, and I've served on a couple of boards with him, and he's a former GE guy, but it had Lucere written all over it. He said, yeah, you have a strategy. He said, but we believe it was a strategy for a PE-owned company to grow revenue and EBITDA. We want a public company strategy to drive higher margin and higher growth. I said, okay, well, we've got a strategy session coming up in April. He goes, hold on, there's more. I said, okay. He goes, we also want you to have a financial goal. We want you to pick the stock price that you want to be in the next, 3 to 5 years, which is the tell from Lucere. I knew it. And I'm sitting there, I said, Jack, the stock price is just a function of our performance and a stock market. And he goes, I don't care if you don't like stock price, pick enterprise value, but you will have a financial target. I said, okay. And there's more. I'm like, there's more? He said, yes. The board would like you to deliver this strategy personally to them in the next 90 days in a white paper that you pen. Okay, Jack. I got it. Jack leaves, shake hands. I have steam coming out of my ears. I got in a taxi. I called my HR guy, Lance Miyamoto, and started yelling at him. I don't understand these guys. First of all, I put them all in place. I hired this board. I ran this company. We have the strategy session, all this stuff. I'm just venting at this point.
Sure. Yeah.
I go home Friday night, pissed. Saturday night, pissed. Wake up Sunday. They're right. So I called up Cornell Stammerin, sent him an email. We need to retool the strategy session, set it out. Sent a note to McKinsey. I was using Gertie Palumbi at the time, great guy. And I reached out to Ram Charan. And on Monday morning, I huddled personally with those 3 groups. And we had 90 days to basically redo our strategic plan that we had been working on for already 3 months. And we basically, threw it away. It started with a new one. And the strategy we came up with was really to get into the higher growth, higher margin areas of biologic and even cell therapy. And, by the end of the year, we had purchased Cook Pharmaca's business in Bloomington, Indiana. And then we later in 2019 purchased Paragon for the gene therapy business. And then we did another acquisition of Master Cells to do cell therapy. And with that, we were able to take our growth rate from 4 to 6 to 6 to 8%. And then after the pandemic, we were able to take it even higher.
I want to ask you about the strategy, that 90 days. So you took about 48 hours to kind of vent and get that out. Critical, well-used time, right? I've been through that. And then you start working, you gather your team, you name them. What does that strategy look like? How much time do you spend looking at the landscape and identifying the opportunities versus execution?
Strategic planning is a process, and it has all the common elements. You start with what's the marketplace? So you find out, where's it growing? Where are the margins? Where's it tough? Then you go to competitors, you do the competitor landscape. So we were actually able to reuse that. But then you actually make choices about growth initiatives. Those growth initiatives, by the way, are not free. They require CapEx and investments. So you know the market, you know your competition, you actually know what you're good at. And then you have what are called organic growth initiatives, meaning I don't need substantial new investment. I may need some in areas I'm already in. And then there's, new growth initiatives that require significant CapEx to bring in new capabilities or M&A. And at the back end of all of this, if you have a strategy, your organic and organic growth opportunities and growth initiatives, and then you have the inorganic pure play, meaning you're going out and acquiring things. And I would say we changed our growth initiatives to be more aggressive in the high margin areas. And it really set the strategy for what did we want to go after inorganically, which was, the biologics, gene therapy. We were also at the time looking at tools and materials that were going in, and think of, the Repligen type companies and stuff that Thermo does and Mark Millipore, but they already have so much of that, it's hard to carve anything out. So we never made real progress there. But in the areas of gene and cell therapy and other higher growth areas, high potent stuff like that, biologics, analytical, we all put that into these are areas that we can grow the company. And by and large, the company did a great job of executing on that. And, best and worst thing that happened to the company was basically the pandemic, because now we're in overdrive that, doing the vaccines and drug substance for COVID and a lot of therapeutics. And, like everybody else, the pandemic we thought was going to be endemic afterwards. And we got even more aggressive with some of our investments, including some that, didn't pan out. I mean, we ended up buying a gummies business that I still really like the business, great adjacency to soft gel, but, it was supposed to significantly double and triple its EBITDA margins. We didn't understand people were taking gummies, during the pandemic. And then after the pandemic, the cash dried up and gummies are expensive, and, it kind of went away. So, it was, best and worst thing, because I would say if, but for the pandemic, we would continue marching along that path. Obviously, there's been some bumps in the road with gene and cell therapy, but, we were really had made some really good choices. And unfortunately, we supersized during the pandemic, and then we had kind of the cliff, just like every other company. The only challenge is Catalent felt it first because we were a mid-year reporter. So we were, in June of 22, what our 23 numbers are going to be, second half 22, first half of 23, while everybody else got to basically, just hold the line until their numbers came out in 23. And then obviously it lasted all the way through 24 in terms of the comparables to what happened in COVID.
Now you developed more capacity capabilities in Bloomington. That's the old Cook Pharmica facility at lightning speed. Did that happen after the pandemic, and how did you do that?
Well, first of all, it was brute force plus help from the government. The brute force was on our part, meaning, normally to build out a new sterile space, to be able to be manufactured, get it qualified, that's at least a 2.5 year period, assuming, you have the sterile filling equipment on order and being delivered. And when the pandemic hit, Alessandro and I were getting calls from, J&J, Moderna, AstraZeneca. And it turns out that we were able to ink a deal with J&J within like 6 or 8 weeks, which is unheard of. It takes a year for us to ink deals. And same thing with Moderna. They just needed capacity and they needed it fast. And at the time, we had a relationship also with Optima. And with the uncertainty of the pandemic, somebody canceled an order. And we basically swooped in and we had a machine on order, and I think we swooped in and got that other machine.
Incredible.
And we had to use all the resources of the, Operational Warp Speed, Department of Defense. I mean, back in the day, you couldn't even fly over technicians from Optima from Germany. We had to basically call up, Carlo Donatore Stefani, who was kind of the head of Operations Warp Speed. He was former Teva guy. He was working very closely with us, and we would have to literally be calling, General Perna and Carlo, and they were clearing the decks for us to be able to bring in the material. I mean, we flew in the material on one of those, I don't know, huge Tupolev planes. I don't think it exists anymore. I think the Ukrainians actually destroyed it. We flew with that equipment, and then it arrived in like 11 truckloads, and it was just 24 hours around the clock. We had a great time-lapse video of like clearing the space and building the structure. But it was special times, and it's nothing different than they did in World War II, or
Yeah.
creating the ability to make at Ford B-24 bombers, outside of Detroit. That's what they did. You just put stuff up, and that's what we did. So a lot of hard work, sweat, sleepless nights by a lot of people. Our contractors were unbelievable throughout that whole period. And then we opened it up. Look, it was an unprecedented time, but the most important thing that happened, I think, from a CDMO industry standpoint, is that number one, governments understood the security of pharmaceutical supply chains, and what was critical there. And then also that the CDMOs were a critical part of the overall infrastructure. At one point, out of the White House, they said that the Bloomington facility was the single most important asset in the fight against COVID. And they meant it. We had the vice president there, Pence and Perna, and so forth, for the opening, or after we had been manufacturing the drugs, stuff like that. But it was an unprecedented time. And, um, I, it's one of those things. I was incredibly proud of what Catalent and the team was able to do. But again, it also put us in play ultimately to go private, because there was such a post-COVID hangover in terms of our revenue and EBITDA, when we were doing, at one point, I think $1.4 billion worth of COVID revenue, and that we thought it was going to go down to 550. We had plans for that. It actually went down to like almost zero. And that's pretty hard to deal with. And so that's the story. By the way, it's no different than Thermo, no different than Danaher, no different than anybody else. And they were still reporting post-COVID numbers. I mean, I'm with Tidal Ortho, who was a IBD testing company, and I think just up until the last quarter, we were still reporting ex-COVID numbers, right? So I mean, this thing's had a long tail.
Yeah, incredible moment in history. And you were there at the right time with the right capabilities. Incredible story. I want to go back and ask you a little bit about the relationship between the CEO and the board. I want to go back to a moment you brought up. You were given 90 days. We want you to personally come in and brief us on your strategy. How did that go? How did they react, and how did that go?
Well, look, they never saw any of my, reaction. I share this now because it's actually kind of a funny and quite self-deprecating story, right? But even the best takes time. And when I talked to Ram Sharan when this happened, he said, John, 1/3 of CEOs get fired for not answering the question at the board, what's your strategy? Because most CEOs just think they can rope a dope their way out of it. I'm running the company and whatever. Other than those 3 days, the board was right. We did need a improved, better strategy for a public company. And with the work of McKinsey, Ram Sharan coaching me in the background, in fact, it was the first time I actually did a prose for the strategy. Ram said, if you can't present your strategy without numbers, it's not a strategy. And so I had like a 4 or 5 day, 5-page prose that said, here's our strategy. And then you'd have the presentation afterwards with the financials of what you were going to do. And we did that anyway. In that 90-day period, we had gotten together with all the board members with a mini version. We did it in threes, where we presented them what we were going to present. We then did the strategy session, and then we broke them off again in threes to say, what are two or three things you add to the strategy, or two or three things that you would take away. And then we brought that all together and ultimately came up with a strategy. From the board's perspective, from time of the question, what's your strategy, to delivering the strategy, they were like, we did our job and John did his, and which was true. But I just tell the backstory about how a CEO responds to what should be a pretty basic question. But after you're invested in the business for 6 years, you do an IPO, actually it was 7 years at that point, it's a tough question to, it's still there,
Yeah, it's a little personal.
it becomes a little personal, but the
So
board.
what you described sound more collaborative than I expected. So it wasn't one single presentation, thumbs up or thumbs down, go do a redo. It sounded like a collaborative process.
It was kind of a look with strategy. It's not you present it and say, what do you think?
Yeah.
Right? You're herding cats. You're trying to get to a consensus. So having pre-reviews, so there's no surprise when they get to the board meeting. They then have the pros, the presentation to read before the board meeting. We then present it. Then we have breakout groups. By the end, you've got, at the time, 9 board members. No, I think we had, nine board members that basically were 100% on board. And here's the beauty. When you have complete alignment between the management team and the board on the strategy, executing it becomes easy because you're not explaining yourself and having to go push it any harder. When we brought Cook Pharmica to the board, it perfectly aligned with the strategy. It was absolutely a unique asset. And actually, the board was willing to pay more money for that company than I was.
Wow.
At the time we paid, I think, 19 times. And I said, I know we can't pay more than 16 or 17. And one director, Marty Carroll, said, well, why not? If this is really a unique asset, all it's going to do, and we need it, and it fits with the strategy, why wouldn't we pay up for it? Now, there's a ton of other stories about how I didn't execute that perfectly because I went out and made a bid for the company without telling the board, because we didn't have M&A committee at the time, and I took it up from 50 to 750 to ultimately 950, and there was some heated exchanges between the director about that, but we ended up doing a great deal where Cook Pharmica said, well, we're agreed, it's 950. And the reason is that Carl Cook, who's the son of John Cook, wanted $1 billion for it. And I said, well, why does he want $1 billion? He said, well, they put 550 million in it. So he thought a 2x return made sense. Like, that's not how it works. Anyway, they said, fine, we'll make it 950 and we'll give you a $100 million loan. So we only had to get 750 of our own. They gave us a $200 million loan that we paid $50 million a year, no interest, over 4 years. And then we also brought in Leonard Green, who we did a pipe into Catalent and gave them shares, and they put in $650 million. That's how that started the whole party going. A lot more to that story. That's a whole new podcast.
Unbelievable. Yeah. So there's so much. Every day, every time I talk to you, it's like we're just scratching the surface. There's another story.
It's 15 years, and I mean, it's a lot of stories. I mean, I'm trying to write a book right now, and I've failed. I first started with ChatGPT. I've now moved on to Claude, and it turns out that I have to mostly write it myself. So I've got 126 pages put into Claude, and I don't know, it's kind of my summer project. We'll see what happens.
Well, it's an epic tale. This is an epic story. It's big. It's going to take something like that. Before we close out, what are you doing now? What are you and if I could get your kind of high level vision on where all of this is going, whether you want to talk about CDMOs or the pharmaceutical industry in general.
Look, first of all, the CDMOs are kind of, I would say, on a, 10 to 15-year run from here on out. There's still plenty of room for growth. They're highly professional companies now. I mean, I went to CPHI last year, and companies that I would like turn my nose up at, you know, back in the day, we wouldn't even look at them. I mean, these are really good companies that I'd want to purchase now if if I was part of Catalent and we were in the buying mode, right? Really good companies. So the industry has really come along. It's professionalized. It is high quality in operations and quality. PE really likes it. They're not great companies in the public markets, given the overall lumpiness, but they're great in bigger owners' hands, like a Thermo and, other folks like that, even the Merck or something. But there's a good run, and it's a little bit of a challenging time from a lot of things that happen. The IRA, had an impact on basically the whole clinical trial space because people went in and just, dr- basically had to cull the herd, right? And so we saw a big pullback in clinical trials. So, and then there's less investment that went into, um, venture capital companies for the you know, biologics. And then, you've got most favored nation pricing that this administration is pushing out. I mean, in the end, they tout it as an America First policy, but really what they want is just lower drug prices, right? So that means a lot of pressure on the pharmaceutical and biologic companies. That being said, they're still doing amazing things. I mean, the GLP-1s has provided a huge tailwind to obviously not just the end marketers, but also the CDMOs that are making the products. I mean, if you're doing peptides right now, you're like you're in a great you're in great shape, right?
Yeah.
So I think there's a lot of good that's happening here, and I'm staying very much involved. I think there's some really good continuing spaces to invest in. For myself, I would tell you after I left Catalent, it's hard when you're day in and day out as CEO, like, your schedule is so regimented. You're up at 5:30 in the morning, you work out, you're on calls on the way to work, you have your meetings, you're on calls on the way back, you're doing some post work, and then you do it all, the next day, and you do that for 14 years, whatever. Um, and then you wake up one day and you don't have to do that. And so you got to find a new discipline. And, CEOs, the reason that they're older is it's an experiential job and you just get better over time, but you don't always have to be a CEO. You can do advising. So I ended up settling into a little bit of a portfolio. I really do like board work. I appreciate the work that I do on Kydell Ortho. Good company, great CEO. I'm also on a private company called Radiology Partners. It's back to my old days in radiology. That's owned by NEA and Whistler and a lot of other investors. They've rolled up radiology practices. They do about 10% of the imaging out there. And it's really kind of going to be a tech company and an AI company. And then lastly is one where I'm spending a lot of time with is Bourne Partners. And Bourne is they were kind of a merchant bank, but they're investment bankers that are focused really in the pharma services space and also in pharma products. But their pharma services space, they really focused out over the last 5 or 6 years. What I do is I bring my network to them to be potential clients for sell side opportunities. So, if a company's out there that is owned by private equity, ultimately they're well positioned, and I supply my expertise to the management teams, and I chat with the PE guys, and again, it's in the hopes of bringing it to Bourne, which the reason I went there is I wish I would have spent more time with Bourne when I was at Catalent, because I knew the team for about 10 years. I knew banks, and it turns out that they're basically swimming in the ponds that I was fishing all the time. And if I would spend more time with them, we were probably done bigger and I don't know about bigger, but maybe better deals and more deals that would have been additive to Catalent. So I do appreciate my time with them. And then I don't know, within the next month or two, I may find myself aligned as an advisor also with a larger PE firm. So a little bit of a portfolio. My wife tells me it doesn't feel like we're retired, but at the same time, what is retirement? I'm doing more of what I want to do, having a great time, and trying to add some value.
Well, John, thank you very much for this is quite a discussion. I really enjoyed hearing all those stories. Great, you're a great storyteller, and I really appreciate your candidness. You presented the good, bad, and ugly, and it's extremely valuable. There's a lot of folks that are 10, 20 years before you that are facing these issues for the first time. It's very valuable. So I just want to thank you for being with us today.
Great, excellent, awesome meeting with you, Perry. And I guess I look forward to the next one where we'll dig a little deeper into a couple other topics.
All right, sounds good. Sounds good, John. Thank you very much for being on the Trailblazers.
All right, thanks, everyone.